And good morning, everybody. Welcome to our first fall 2025 LinkedIn Live event. It's also a special Monday episode. We typically, for those of you who join us, we typically do these on Fridays, but this was a special Monday event. This is really, really interesting and exciting for us because for those of you who joined us, you know that we typically bring in experts in the area of healthcare IT, on professional services, and we have vendor partners that join us as well. In this case, we're able to bring in a collaborative partnership between the vendor, the client, and the product. And we're going to speak about real life outcomes based on this implementation and optimization. With me today, we have Betsy Stofsky and Ginny Pribinek. I'm going to let them do their own introductions. Betsy, why don't you please introduce yourself, and then we'll head over to Ginny.
Sure. So my name is Betsy Stofsky, and I'm a project manager in the Heart, Vascular, and Thoracic Institute at Cleveland Clinic. But for 25 years prior to that, I was manager of the Heart, Vascular, and Thoracic Institute website and Resource and Information Center. And for even longer than that, I was involved with many patient education and digital projects within the Heart, Vascular, and Thoracic Institute.
Thank you, Betsy. And Ginny, why don't you do the same?
Hi, I'm Ginny Pribinek. I'm the founder and CEO of a health IT company called MedRespond, located in Pittsburgh. We do conversational patient engagement to support patients through their healthcare journey.
And we've been lucky enough to work with both Betsy and Ginny now for several years. I think our first interaction was right around the pandemic. And since then, we've been doing a lot of different work to implement and optimize this solution. So let's get into the story. Again, this is a great story of partnership and collaboration. So Betsy, we're going to start with you. Obviously, you were looking for some sort of solution. Why don't you tell us a little bit about that? What were your objectives and what were your challenges?
So initially, our objectives were to provide an interactive program that our patients could get their questions answered. They could learn about their procedures when they wanted to learn and where they wanted to learn about their procedure. And the second thing is that we wanted to make our healthcare teams' appointments more productive. They spent a lot of time repeating things that were often process-oriented rather than actually about their procedure. So we wanted to help with that and also possibly decrease phone calls that were coming in about more process-oriented questions. And then last, we wanted to make sure that we were utilizing technology such as our EMR to communicate with our patients rather than introduce some new product to the process.
Fantastic. And so tell us a little bit about the plan. What was the journey to find the right partner for this?
So we had a few actual goals in finding the right partner. First of all, as I mentioned, we didn't want a partner that utilized a different platform than our EMR. We wanted to make sure that that was the portal that the patients used for this program. The second thing was we wanted to make sure that the program was individualized, that it wasn't just about all heart surgery, that it was about a patient's own specific surgery as much as possible and their specific doctor. The third thing was we wanted to make sure that the platform had a way to educate the patients with what we felt was important, but also that there was a way for them to ask questions and they could get their questions answered within the program. The platform had to be expandable. So we wanted to make sure that, we're starting here, but that it could grow with us as we were able to expand to other programs and locations. And we also wanted to be able to see data. We're very data oriented. And so we wanted to be able to see what the program usage was, how patients were engaging with it. We wanted to be able to track questions that were asked and learn from that so that the program could grow.
And that's great news. As you'll see later, we'll be talking about some of those data and tracking and some of that interaction. So let's shoot over to Jenny now. So Jenny, tell us the story of MedRespond. So how did MedRespond get involved here? What was the journey that partnered you?
Well, I'm very proud to tell you how our relationship with Betsy and the clinic came about. MedRespond had entered what was called the inaugural Cleveland Medical Capital competition in 2017. And there were literally thousands of entries from around the globe that came into that competition. And 120 were chosen to come into Cleveland and spend a few days working and refining their pitch and then showcase and deliver their pitch to the audience. And I'm really proud to say MedRespond won first place, which was,
Phenomenal.
to this day, I still can't believe we won. Um, there was a cash prize, which is always nice for any entrepreneur, but the more significant part of the prize was that we got an introduction to the Cleveland provider of our choice. And being the committed entrepreneurs, we of course chose the Cleveland Clinic. And as a result, the innovation group within the clinic introduced us to various stakeholders who may be interested in our technology. We were interested to the cardiac team, the liver transplant team, and the orthopedics team. And happy to say all three were really very, very interested. But it was the cardiac team that won the day because they had such a clear vision of exactly what they wanted to do. And they knew the program they were looking for to support the patient throughout their journey and in recovery in the hospital at home.
It's a fantastic story. It really makes all of us entrepreneurs really excited to have opportunities like that. So then, why don't you tell us a little bit more about MedRespond? Why don't you explain a little bit more to the audience so they know what we're talking about here?
So MedRespond, as I said, is a health IT company that was a spinoff of Carnegie Mellon University. And it's pioneering entertainment technology center and its world-renowned language technology institute. So they were combining the technologies through the ETC in a way to tell a story and to communicate with people. And they were using cutting-edge AI systems to interact with humans using language, using natural language processing, using machine learning, using all of the, as the founder of AI, and many consider community in Carnegie Mellon, it was a great place to start. And I started working with the team that was doing this innovation, and they asked me to explore what were the different use cases and what was the best and most important use case for a technology that simulated conversations. So we went around and we did some experiments with movie stars, and we did experiments with historical figures. We had one of our researchers become Einstein for quite a while, and football heroes. So I hung around with the Steelers a little bit. And what we finally realized is it was the conversation with healthcare providers and the doctors that really made the difference and was, in my mind, going to have the greatest impact and the greatest return for patients and for caregivers. And that was basically the beginning of MedRespond.
Fantastic story. Thank you, Jenny. All right. So obviously, first thing that happened was some sort of proof of concept, I'm sure. So, what was that process? What did that process look like? Jenny, I'm going to turn it back to you for a second, and then I'm going to go over to Betsy. How did you go to, how did the POC get started?
Well, as I mentioned, the Cleveland Innovation Group, the lead on the patient engagement was Sonia O'Malley. And she took us around, introduced us to the stakeholders. And when we got the buy-in from the cardiac team, Sonia coordinated all of the sign-offs we needed from leadership at the HVI, the surgical team, the cybersecurity, and patient engagement. So she held our hand through the whole process and helped us complete the contracting in order to begin building the POC.
That's good. And then Betsy, tell us about the parameters. How did you decide what the POC would include?
Well, we knew we had to show some sort of proof of concept with data. We had to support with data. It wasn't just like, oh, great idea, go do it. So we started out with a pilot study, and we had, we had this idea, this dream for years, and we had two surgeons that were really involved in that creation for a while. And so we did the pilot study with those two surgeons, and we took two specific procedures: isolated aortic valve surgery and isolated mitral valve surgery. And excuse me, we tested 75 patients for 5 months. Excuse me. During that time, of course, we did not integrate the EMR. So the nurses had to manually register the patients on a platform where they put in patient information such as the surgery and the surgeon. And we worked with MedRespond to create content. We did have some content from our surgeons because we, again, we're looking at how do we do this project. And so we did have some content from videos. We had written material. We already presented to the patient, but those were all presented during appointments. So we had to create all of this content, and we used scripting from the resources that we were already using, really, which was those classes or appointment information, along with we reached out to our pre and post-op teams to ask them what questions patients most oftenly asked during their appointments, pre-surgery, post-surgery, and even when they went home, what phone calls were coming in after the patients were discharged from the hospital, to be able to create this proof of concept. Our results, sorry. So our lessons learned. So we were really amazed, actually. We were overwhelmed by the results of the proof of concept, and that the patients use the program most often at home. They could use it in the hospital if they had a, smartphone or laptop or tablet, but they really used this program before they came to the hospital and then at home. We had very high patient engagement in the pilot study. Patients looked at the program 6 sessions per user and had very long minutes, 70 minutes per user, which is something that we had never seen in any patient education programming. And it was amazing, really. And our caregiver satisfaction data was pretty anecdotal. However, they did tell us that their patients were more prepared when they came to visit, and their questions, the quality was better. They were more specific and less process oriented. They stated patients who watched the program said they really liked it and felt better prepared for surgery. So it was really met and really exceeded our expectations.
Yeah, every one of the things you were looking for, it sounds like it exceeded the expectations, which is phenomenal. So Janie, from the vendor's point of view, what were the lessons learned from the vendors?
Well, we had a huge benefit in working with Betsy and the team there, because they had a clear idea of how they wanted the engagement to work. They wanted to build on their traditional approaches with brochures and binders and traditional videos. And we wanted to engage the patient in micro bursts of learning, so that there's 500 videos there, but they're all 30 seconds to a minute long. And patients see them as they're ready. When they want to take a break, we come back, we pick up where they left off. So it really allows the patient to create their experience, to choose when and where, how much, to ask their questions along the way, things they don't understand. One of the top questions we got was, will I be in pain? And the carefully crafted comments came from Cleveland's clinical team that basically said, yeah, you will be in pain. It's part of the process, but we're there to manage it. And all the communication through the program was very reassuring, very comforting, and very complete. It was just a great experience.
Very realistic. I mean, it really covered everything that needed to be said. Did you have any?
Well, if I can just make one point, one of our concerns early on, and we'd been told by people that the clinical team is going to resent you because you're replacing them. And in reality, that didn't happen at all, because as Betsy pointed out, the nursing staff said, I'm no longer answering phone calls about parking or, where I can stay overnight. The system does that. If patients have those questions, they can get all of those answers. Instead, when the patients call the surgical team, they're asking very relevant questions that enable the staff to operate at the top of their license.
And that's key. I mean, I think that's a lot of things, especially when we talk about AI solutions, regardless of what they are, is how the clinical leaders and the clinical partners will accept them. So I'm sure that was huge that the nursing staff had no issues with this and found it beneficial to their day-to-day and the things that they needed to really be able to perform. It's fantastic.
Chris, if I can say one thing too, in working with the clinical team as we implemented the program, Betsy was incredible in assuring that we were developing a system that fit the workload and that fit the workflow within each group, so that we supported them instead of putting additional burdens on to their shoulders. And that was so important, that we enhance their experience, not put a burden on them.
And that again goes back to the partnership, the collaboration. It takes both sides to sell a solution. It's not just the vendor, it's not just the client. It has to be a collaborative partnership. So that's what made this so successful. All right, so 5 months go by. The proof of concept is a huge success. Everybody is like clapping themselves on the back and saying, "Look, what's next?" So Betsy, tell us, what was the next steps in order to move it from a POC into a full implementation?
Mm-hmm. So we had to have the program or the project approved by 3 different groups. We took our results to our institute leadership first, and then the Office of Patient Experience at the clinic to make sure that we were meeting the needs. And then this was a new need. This was something really unique from other types of patient education that was being provided, or patient engagement projects that were being provided at the Cleveland Clinic, and also our IT Architectural Review Board. So all of those needed to be to approve the project before we were able to move forward.
Yeah, I think that's actually when we first got involved. It was a conversation with your Architectural Review Board. This is back in 2020 on how we would integrate with the EMR and make sure that we had a plan that everyone was comfortable with. So it was a journey for sure, but obviously you got approval from everybody else. And just to our audience here, can you give any recommendations for anybody that's going down a similar path? How do you gain that support? What's the best thing that they can do in order to gain that support within the institution?
So the one thing that we had right from the start was, as I mentioned, this was a project that we dreamt about for years. So actually, when we started going, it was like, can you believe this is really happening? So we had the great surgeon champions. So we had really champions that started from our physician teams. But most importantly, and I think Jenny alluded to this too, you need to have the caregiver buy-in as well. And they need to feel like they're a part of this, and they need this resource to help ease their workload. It's not going to add to their workload. They also, it needs to work seamlessly, into things that they're already doing. And our program, I think having a pilot project to introduce that to them, help demonstrate that. And I think that's a great way to show data or results when presenting any idea, really.
And I think the data, to your point several times, is key. You're going to bring it to new audiences. The first thing they're going to see is, well, what are we getting out of this? And be able to show solid data, clear data is a phenomenal outcome. All right, so then we go from proof of concept. We're moving into implementations phase. Obviously, there is a process that happens within any healthcare organization on how you go through contracting. So time goes by a little bit. We jump forward a year or so. Contracts are put into place. Program teams are put into place. And we move into implementation. So we'll start talking about that now. I'm actually going to jump in for a second because that's when we started partnering with MedRespond and the customer. And this is where we started conversations in security. We started conversations in EMR design. We started conversations in project resources and all that. And even that takes time. We all know that you need to get through security reviews. One of the requirements is that we would not store any PHI within our system. So there need to be integration points that no matter how many times the patient went in there, we would retrieve the information that we needed to pull the record, but we would not store that locally. And that was a huge win for us because then we didn't have to go through additional security reviews with the organization. After that was completed, and that took about a month or so, then Cleveland Clinic had resources assigned to the project. And I have to admit, it was a great collaborative implementation as well. We had a strong project manager. We had some great resources within the clinic to help us within the integration. And it was interesting, and I think we'll speak about this a little bit later. Even the initial strategies that we had for implementation had to change along the way. But we had the right experts on the call to make quick decisions and say, oh, we were going to go with a scheduled event. Well, the scheduled event doesn't necessarily work the way we expected it to. Let's go with an ordered event. But the best thing is we had some really strong resources on both sides to be able to work together and to get the program going. So the initial strategy for the EMR implementation was we used FHIR as our mechanism. It simplified some of the integration steps that we needed to do. However, as you know, a lot of my technical colleagues will know that FHIR is not FHIR for everybody, and we did find some challenges along the way. But we were able to overcome them. And with the help of Betsy and with the implementation team and with the Epic technical teams, we were able to find solutions, and we ended with a pretty slick integration where the patient would, an order would be placed with the surgeon's name and the procedure type. It would go into the patient's My Chart. The patient would go to My Chart and find the video link, and then from there they link it, and then it would go to MedRespond. We'd pull the information that we needed to in order to pull up the appropriate training. And this could be done over and over and over and over again. This was the best part, and this was done safely and securely. And I think ultimately the solution worked out very, very well. To both of you, and this question's to you, I mean, besides the technical pieces of it, which we kind of just talked about a little bit, obviously then the content really needed to be created in a more formal fashion. So Betsy and Ginny, I'll point to both of you, but how did that go? It's the content creation piece of the first phase.
Mm-hmm. Well, I can start, and then Ginny probably has more information about this too, but on her end. But, we did have a lot of class outlines and videos and written materials. We've been doing patient education for years. So we did have a lot of information, and we combined this, as I mentioned, with the questions that we received from the pre-op and post-op teams, but also we did learn from the pilot study. We did learn how patients were using it, and they put in questions and, within the program or asked questions. And so we learned a lot from that pilot program as well, which fit into our content. And we worked very closely with MedRespond, and Ginny can talk about that. There's her side of this.
Well, we've done a lot of working with Betsy, but it's like I don't think there's a week that goes by that we don't have a conversation with Betsy, and those are all incredible because Betsy is incredibly diligent in everything that she's done, and she has such a strong view of what the provider and the patient are looking for. You couldn't ask for a better champion in terms of that. And when we started working with Betsy, we looked at, everybody has a bunch of brochures they use and different things. That's a good starting point. But when you're talking about a conversational system, it pushes to have the information formatted a little differently. And the way we, learned it from other experiences is that it works to do it sort of in the time, on a time sequence, like follow along the patient's experience, what's happening first, what happens next. And it builds a logical sequence of how, then when on the first day of surgery, this is what's going to happen on the third day. And that's really what we did. So we agreed to what the outline would be, and then we started identifying what are the individual pieces of information that we're going to include. Betsy scripted it. Then our content team would edit some things to make it fit the conversational flow better, because a lot of things are written in a third person where you're talking about, the clinic, but now you're saying this is how you are. You're going to experience this. And it was a different way of formatting it and addressing that conversational approach. And then we would also refine it so that it fit into the NLP and the linguistic modeling systems. So, and it was back and forth and continually collaborating with Betsy to get it right.
And I'll state it again. It was the overall collaboration. I mean, every project has its up and downs and ebbs and flows and all that type of stuff. But between Betsy's ability to drive the team overall, between the clinic's availability of their Epic resources and us being able to get contact to them when we needed them, and to the overall solution, I think it just became something that was very strong. And I think ultimately we went live in November 2023. I believe was I don't remember the exact date, but early in November 2023 is when we brought the solution live. From a support provider, it's just a couple thoughts for the people listening. We were concerned about a couple things. Obviously there was a support process that needed to be created between the client and the vendor to make sure that the end user, the patient, wasn't caught in the middle if there were any issues. And of course, since this is a product that uses a lot of different technologies, including, it has a server and a storage and everything, but obviously this is shown on a device, whether it's a phone or a tablet or whatever. We were concerned about bandwidth. We were concerned about OSs. We were concerned about browsers and all those types of things. I can state, though, I think we had 1 or 2 calls to optimize the call process. We got those numbers cleared up. The good news is that we really don't get a lot of tickets. Every once in a while we'll have a patient that'll have an issue, and then we'll reach out to them and make sure that they get the information that they need. But it's not a overly heavily supported application on both sides. And then when we do have an issue, we get on a call. We get involved very quickly. We have our experts, Beata, thank God, is a wonderful human being. We love her to death. She gets with our technical team, and we resolve them very quickly. But overall, I have to admit, there were a lot of concerns about what would happen with volumes, with performance, and we just haven't seen that. We've been able to maintain, obviously Betsy to make the final say that what I'm saying is true, but I think overall the support and the response has been excellent.
Yes,
Chris, if I can tell you that the team, that collaboration between Beata and you and the Epic team, I call you guys the miracle workers, because no matter what happens, you get on the phone and with the solutions come forward, and I thank you all for that.
Well, it's good to work with good people, so it's a very collaborative relationship, which is great. All right, I think Betsy, we're going to have you walk through how the process works and point out some of the key milestones of it. I think we're going to slide for the. Yep, here we go. Betsy, why don't you walk us through the process?
Okay. So first of all, our interactive heart surgery program is very exciting, and we didn't mention this, but I think this slide will definitely showcase its features, but the narrator, first of all, is very amazing. And we actually chose the narrator from one of our patient panels. So our patients had input in choosing this type of narrator, who felt that she was very empathetic and calming when she answered questions. So I think that's important too, because we've actually through the years been, sometimes you see videos where a doctor is explaining things or, somebody else, and you're like, do I feel comfortable with that person? So I think that this was an excellent choice and has continued to be so. When we go through this, just to highlight some things, I added some numbers there so that it can draw your attention to that. But the first thing is number 1, which shows the left-hand navigation when a patient looks at this slide or looks at the program. And that introduces people to welcome to the program, welcome to your organization. It provides information for preparing for their visit. It gives you information about your condition, your pre-surgery, the procedure, any type of other things that you need to know, day of surgery, during the surgery, the hospital stay, and how to recover at home. That number 2 there within that section on the right-hand navigation, it introduces the patient to their provider. And in our case at the Cleveland Clinic, we utilize surgeon bio videos that have been created for our surgeons, but that could be anything from, any video that somebody decides to create that says, welcome, this is me. I want to introduce myself to you. And the third thing is number 3 there in that little box underneath the video screen. The patient can ask questions and get answers throughout their video. So a good example is a patient could be watching the program and their spouse comes in and says, what time do we need to be there? Or where do I park? Or, how do we get there? How long is it going to take us to get there? And that answer can come up right away. And then they can return to the spot that they were within the program.
And that's both verbal and typed questions, correct?
Yes, all of the questions, the entire program is narrated by our narrator through video, but also the text is underneath the video as well. So if that's better for somebody, they can read along with it as well. And number 4 is on the left-hand side. That's also consider asking. So that's kind of like things where you're on a website and you're shopping and somebody says, oh, you may also be interested in this product. Well, that's a similar thought process, is that those are things that we've either learned through our programming or things that are not necessarily you have to know this, but things that they may also want to know on the right-hand side. And then number 5 is a resource library on the top right, is a place where you could put all sorts of forms. You could put maps on how to get there. There's links to a lot of websites. There things like, how do I get my medical records, all sorts of different things that you could put in that section. So that's been very, very helpful. And the other thing is that our contact information is always readily available. So that's number 6. So patients always...
It's whited out for security purposes, but there is contact information there.
Yeah, we have the phone number, website where patients can always connect to their healthcare team. Yep. And another great aspect of the program, like I mentioned before, we're very data oriented. And so the program has a dashboard in which we can always look at our outcomes. We can look at how patients are using the program, how much time they're spending on the program, and common questions that they're asking during the program, so that we can constantly learn and grow from this usage. And truly, for outcomes, they've been very similar to our original pilot, which has been amazing. The patients tend to spend only 2 times, per person session versus 6, I think it was in our pilot. But they are spending about 70 minutes per user on the program, which is quite amazing. And our team continues to be engaged with the process and rely on it to keep our patients informed. They may ask us to add something to the resource section or make changes to it, add another form or resource. Recently, we started adding things like our pre-op information to the resource section, so patients have all those forms and things that they need pre-operatively. So we just added that. We can also add videos that the surgeons or the healthcare team has created about their teams or certain surgeries. We've added that to the resource section, and also the also consider asking section. So it's modifiable as you go with the program, which has been fantastic.
And just to clarify for everyone, how long do the patients have access? Thank you for the comments, Matt, to the system pre-surgery. Obviously, they can look at as much as they want pre-surgery. What happens post-surgery?
Yeah, so they can look at it as long as they want. We, and sometimes we don't have access because of the way that we store data as far as looking at how much time patients are using the program onward. But we didn't put an endpoint on when they can stop using it, because we felt like their recovery time may be different from patient to patient. They may want to go back to it. Yeah. So we didn't really put an end time to it.
And I think a lot of things that you brought out here means that this is very much living and breathing. Resource information will change. Clinician information will change. Some of the video content will change. So there's constant, we do reviews of how to update this and optimize this clearly.
Right.
All right. So Jenny,
go ahead. I was going to say a great example of that is that when we started this program was during COVID. So we had a lot of restrictions related to visitation. And then of course now it's different. And so we've been able to update that easily. So that's a great example of that.
And we'll talk about this a little bit later as we've extended out to other clinical services, some of that integration points and some of that technology in the background how to be optimized to allow for additional filtering. All right, so Jenny, let's turn over to you then. Betsy gave us a great summary of how it works and what the data showed. What are the testimonials? What are we hearing from surveys and things like that?
Well, as I want to mention, Betsy mentioned the dashboard. And so what we do at MedRespond is we track and report every piece of data relative to the usage of the system. So we know by anonymized patient how many times they log in, what time of day, how long they stay, how many videos they watch, which videos they watch, how they answer the questions we pose during the program, and how what questions they ask. As part of that, we've introduced a survey. So the program is self-documenting its efficacy all along. And as part of the survey, there are 3 traditional questions that are a Likert scale. And consistently, the Likert scale reports are 4+, 4.3, 4.4 on all of the, is this valuable? Would we refer it to a customer, someone else? And did this make you feel good about your choice for surgery? And then the last thing we ask is we ask the patient if they have any comments that they'd like to share with us. And I like to go into the dashboard and review those from time to time, because it makes me feel so good.
Little Monday morning cheer me up, right?
It's like, boy, I've had a bad day. Let me look at the testimonials. and who wouldn't? Like, I'm just looking at a list in front of me right now, and the one starts with, wow, this is amazing. And I went, okay, I like that. And the person actually shared with us, they went to another hospital and they said, I have a bunch of questions. And they were told, look, the surgeon will take care of everything. Don't worry about it. And it's like, well, let me go back to the clinic. That's all I have to say. People have commented it's an excellent way to get the information for themselves. It's informative without being overwhelming. They like that they can come in and see it and use it on their own time. They can revisit it again. They can revisit it many, many times. Another comment is it's a fantastic program and so worthwhile to get the information before the surgery. I mean, I'm sure we've all had experience. You're getting your post-surgical instructions while you're just still coming out of the anesthesia fog. So that's not the way Betsy designed this. They designed this so you learn the day you plan your surgery, you learn about the whole process. And I think that's so important. And the level of information that's in this system is just amazing. You're not going to find a comprehensive and complete data that's there. And it's, I look at an interview I had with a user of the system was someone we interviewed an engineer at the end of using the system. And I asked him, what did the program mean to you? And he said, well, I think you saved my life. And I said, really, how did we do that? And he said, well, you told me to use a clean towel. I would have never used a clean towel on my own. And I just really want to give you a little flavor. One of the things that, just an example of one of these comments, I want to highlight one where a patient said that the program was delivered in a thorough yet compassionate manner. And you know, I just want to share with you what is it that we do? What is it that Betsy and we did together that makes a patient call this thorough and compassionate? So if I can just share one response that comes back. If a patient asks, what happens when I wake up from surgery? This is the response.
Waking up from surgery with a tube down your throat. Waking up from surgery with a tube down your throat can be frightening for some. Rest assured that you are safe and being watched very carefully by the staff in the ICU. The tube is connected to the ventilator that is helping you breathe. The amount of time you need to stay on the ventilator will depend on the type of surgery you had. For simple procedures, such as a single valve surgery, the breathing tube may be removed between 1 to 3 hours after you wake up from surgery. It is important that you are able to breathe on your own and hold your head up before the tube is removed. If your surgery was more complex, you were having a reoperation, or your surgery was long, you may need to be on the ventilator longer.
I just really wanted to share the empathy and the way she describes it. You're not getting that in a brochure, and you're not getting that in other means of communication. And this is what makes the education so sticky for the patients and their families.
Yep. It's the calmness, it's the empathy, as you said. It just makes it very easy to digest. All right, well, so that was phase one. As you can tell, it was a great success, both technically, implementation-wise, functionally, clinically. Let's move on to scaling and optimization now. After a period of time, we moved from the first phase, which was just cardiac, and we moved into expand to EP and interventional studies. We're now showing a slide of some of the additional content that was created. But Betsy, what can you kind of go speak a little bit about phase two and the thoughts that the clinic had?
Yeah, so, you know, as we've mentioned multiple times, we do have the dashboard, and that information really presenting that to our teams, to our leadership teams, have allowed other teams to say, I want this for our program as well. And that has allowed us to engage and expand for our patients. And the next two programs that we recently launched were electrophysiology and intervention and structural heart. And they've only been launched for a couple of months, but so far their response has been very positive as well. We have continued satisfaction and engagement. So the patients also engage in the program on an average of 2 times per user. And that's the average. Obviously, people do it, you know, many times, you know, depending on their needs. And they spend a little less time, with an average around 50 to 60 minutes versus 70 minutes, but it's still
a lot.
Amazing, right? It's incredible. And it's, you know, it's important to note that, you know, every patient population has different instructions. So we want to, I want to just note that we were able to build different instructions into each program. So, but also each clinical department, at least in our hospital, has some similarities, but they also have differences in the patient flow. And it's very important to work with each team to allow the ordering process to work within their flow, and also have a lot of input into how the program's introduced to them and how they'll utilize the program. And each group is very, very different. But we were able to do that with, you know, all three of these utilizing the same process with MedRespond.
But you bring up a good point, and I'll talk about some of the technical challenges, and then Ginny will go to content. You know, obviously we made the integration with the EMR robust enough in the first phase that we knew that we can use it for the second phase, and it was but every phase is different, and every phase needs things to be revisited. There were some differences that we needed to some filters we needed to put in place, whether it was a cardiac or an EP exam or an interventional. But also then we started getting to different ideas about the order. Some orders did not have a clinician necessarily at the time of order. And how were we going to handle that? And I think you mentioned this way back in the beginning, that you can create a generic video if there's no specific clinician, that you can just have a video come up and explain the general idea of it. There are also times when, since there were changes in the clinical staff, that the videos weren't necessarily ready. So we had to have solutions for different types of integration steps. And then we had to have solutions with different types of video streams. So while, it seemed like it was just let's go from phase 1 to phase 2, obviously you always need regression testing. You always need to make sure that you're working with all the different use cases. And I think while it wasn't, a very complicated necessarily change, they were very important changes to make sure that phase 2 worked appropriately.
And Chris, I think you mentioned before, like with cardiac surgery, we were going to do auto orders related to when a procedure is scheduled, the program would just automatically go out. And we decided that didn't work with cardiac surgery. Well, with our intervention patients, we are in fact using that. So it still is, that flexibility is built into both the EMR and MedRespond to respond to that ability to order it however you want to, whether it's through ordering or through auto order with other ways that you order a procedure, it's available.
And just a little bit more information, the reason that the auto procedure didn't work the way we wanted it to is because there are multiple procedures that can be selected with the cardiac, and we didn't get the responses appropriately to the FHIR interface. And just a technical challenge we needed to overcome. We put the Cleveland Clinic on a call, we got on a call, we figured out the best solution, and we moved it forward.
Correct.
So Jenny, why don't you speak a little bit towards the content creation for phase 2? Because obviously now you're moving from one clinical area to 3, and with all the slightly different variations of it.
Well, whenever we started planning the expansion, and I think, remember, the POC had 2 surgeries. When we started planning the expansion into all of the surgeries listed here, and intervention and structural heart and electrophysiology procedures, I really was so relieved we had a modular system. It's a modular system with the reusable components where you can take the information and share it across procedures, or you can make the information specific to only one procedure. And that's important because while you have this complex system with hundreds of responses, we need to know that if the patient is asking us, how long am I going to be in the hospital, that's going to be a very different answer for a patient having CABG versus a patient who's having a pacemaker insertion. And so the system has to be able to handle that complexity and that flexibility. And if there's anything that working with Betsy and her team taught us, is we always need to be flexible. Because just when you think exactly how it will be, there's always an exception to every rule, and you have to be able to deal with that in order to be able to respond to the clinic.
Our response is just call us Cumby, right? All right, and Betsy, I think you've said this before, but I just want to kind of summarize it one more time. Adding in 2 more clinical areas that we were all concerned about, additional volumes, usage growth, support, and all those things. Can you just give us a summary of how that's worked?
Yeah, it's actually been is more seamless than that you would think, because we, of course, when you initiate a program, there's always the first week, like something will come in and you're like, oh yeah, we didn't realize that would be an issue. But our internet teams, as you mentioned before, and MedRespond really work closely together, and we're able to respond to those issues quickly. And they were taken care of. And, it's important to in-service all the teams, from the nurses to the administrative assistants to anyone who knows, who would answer a patient phone calls, to know that those programs are available, how they're being ordered, and then what to do if there are issues or incoming calls. But really, I thought there would be a lot more problems with the increased volume, and I was concerned about that. but there hasn't really been any.
No, and I can tell you from a sports side, we've been lucky. It's only been a couple handful of things. And I think they were from initial implementation gotchas that we just needed to deal with.
Mhm.
Another question came up, and I just want to throw it out there. We can answer it now. We can answer it later. So, how does patient confidence translate to better outcomes for the patients in the Cleveland Clinic? What have you seen internally based on the fact that the patients are better prepared?
Well, I mean, I think that what we've seen is maybe patients are, like I said, more prepared for their procedures. And I think that they feel better based on our survey results. They're happy with the program and feeling better about what, how they were prepared. And I think that also our incoming survey responses with the new programs convey the same feeling. Like patients are like, thank you so much for preparing me for this. And I also think, sometimes like maybe for heart surgery, you wouldn't necessarily have, hopefully you don't have a lot of repeat surgeries. We know that happens, but it might be hopefully years apart.
Right.
Sometimes for some of the electrophysiology procedures, they maybe have more of those, more frequently. And the flexibility of the programs to for patients to jump around and also just ask questions allows people that maybe they've had a procedure more recently. They don't need all that information again, but they're able to get their current questions answered and go back and learn what they really need to learn, not necessarily everything that a new patient would need to learn.
Exactly.
So I think that it's just translated to our patients, really feeling better about their procedure and their caregivers. I hope to look a little bit more closely at that over time. We're trying to look at more patient satisfaction type information, but we haven't yet, other than the information that we have at our fingertips. So
Understood. More to come for sure. All right. Well, our wizard behind the curtain is yelling at me that we only got about 9 minutes left, so I'm going to rush some of these through at this point. Like I told you, it gets to 50 minutes very quickly. So, Jenny, why don't we talk about other hospital systems for a moment? Obviously, this has been such a great success. Has MedRespond been able to support other hospitals as well?
Yeah, and one of the important agreements we have in our collaborative relationship is that now that we've built this incredible cardiac support system, we can license it to any other cardiac system in the country. And what that means is, we don't take the Cleveland Clinic version and plug it in at another hospital system. We private label it. We put we make the logos, the custom, the feel. We make any client who's licensing it, we make it their product. So that whenever you go to the program, when the program gets launched, it's their clinicians greeting the patient. It's their lobby that the patient sees. And it's all of the specific information. Where do I park? And all of that custom information. So we've already licensed the program to a few other systems. We're in the process of expanding that now. And we'd really like to share with every cardiac clinic in the country how you can get the same results that we have in this experience.
Same positive outcomes. And from a technical perspective, I'll tell you, we spent time with the clinic getting it right, and from a strategy of implementing into the EMR. And we said, oh, great, we'll use the same strategy for client number 2. This should cut the time down in half, should be good to go. Well, that was only part of the technology at the other client. And so we had to spend weeks troubleshooting some of their security systems in the way. So again, this just goes to every client's different. Obviously, the tools will be the same. The implementation will be similar, but there's always challenges that we need to approach regardless of who we're working with. It was another great implementation, but it was not the slam dunk that we had hoped it would be. Obviously, we learn each and every time that we implement. All right, so let's talk about what's next. Betsy, any guidance for what you would like to do with this going forward?
Well, I would like to see the expansion of this to all of our hospitals and hospital systems. We don't have any plans for that right now, but I think with the expansion of the product to include all of those different procedures, as well as, Ginny keeping on expanding the technology that they're using with AI, will help keep costs down and the ability of hospitals and practices to expand more easily. And so I definitely can see this being used in not just procedures, but chronic conditions and wellness journeys. So I hope to see that.
Thank you. And Jenny?
Well, one of the things I mentioned that the testimonials come through on the dashboards. One of the comments we've heard over and over again is, you should have this for every procedure. And that would be our goal. We're talking to different groups about doing the same kind of a treatment for orthopedics, for audiology and hearing health, and those kinds of topics. And I had a personal experience last week where I accompanied my sister through gastrointestinal surgeries at a different hospital system. And I just immediately, all I could sense is, why don't we have this kind of a solution for gastro? Because it was a very complicated procedure, very complicated recovery process. And through the whole thing, I felt we were flying blind. And I think for a lot of healthcare, patients going into critical surgeries often have that feeling. And it's like people are given brochures and, that's not doing it. It's the kind of solution that we've been able to collaborate with the Cleveland Clinic that goes above and beyond, because they've always want the best. And we're always striving to deliver for them.
Excellent. All right, we just have time for closing statements here. Betsy, I'll let you go first. And then Jenny, you can wrap this up for us and tell people how to get in touch with you.
Yeah, I just feel so thankful that, Ginny's team presented at that conference, and they, Sonia introduced them to us, because again, it was just a longstanding dream of ours to have a program such as this. And it's important, to find the right partner to make it come to life. And obviously, as a clinician, we're content experts, and we know what patients may need or want, and very much experience with conditions and procedures, but we're not obviously experts in the technology. So we're happy that MedRespond was able to collaborate with us to merge the clinical insight along with their technical innovations to create such a powerful resource for our patients. And it reflects our vision and our patient needs. And I really cannot be more thrilled. So thank you, Jenny and Chris.
You're more than welcome. And there's actually a wonderful comment from one of our listeners. We're showing you right now. It is rare to get a win for both patients and providers. Sounds like the solution achieves both with results you are seeing describing. Congratulations to everybody for this great success. So thank you. Thank you very much for the comment. Jenny, if anybody's interested, how do they contact you?
They can call me, as Betsy knows, any time of the night and day. And I'd be more than happy to share with them our experience and tell them how we can put this powerful solution to work for their patients.
Excellent. Well, listen, it's just about time to wrap up. We want to thank you all for joining us on a Monday. We'll be having additional LinkedIn Lives throughout the next couple of months to wrap up 2025 and prepare for 2026. Please share them with your colleagues. And if you have any questions, you can reach out to us on LinkedIn, and we'll be happy to direct your questions to the appropriate people. Everybody have a fantastic day. Betsy and Jenny, thank you so much for your time. This was a great session, and I hope everyone has a wonderful day.
Thank you. Bye-bye.
Thanks, Betsy. Thanks, Chris.